Hey everyone! There is a question that many men over 50 carry in complete silence. A question they have never asked their doctor, never raised with a partner, and never fully resolved in their own minds. Because the cultural noise around it has always been louder than the clinical clarity. That question is this still healthy for my body at this age? Is what I am doing helping me or harming me? Should I continue? Should I stop? And does any of this still matter at 60, 70, or beyond? Today, I'm going to answer that question completely and honestly, with clinical evidence, without shame, and without the kind of vague reassurance that leaves men no more informed than when they started. I'm Dr. Amara, a men's sex therapist with over a decade of experience working with different couples and helping men regain their sexual health and strength back. Sexual self-care in older men is one of the topics I discuss most frequently in clinical settings. And it is also one of the topics about which the most unnecessary guilt, confusion, and misinformation exists. Men over 50 have largely been left without clear, honest, evidence-based guidance on this subject. The information that is available tends to swing between two unhelpful extremes, either cheerleading without nuance or moralistic warning without clinical grounding. Neither serves you. What I'm offering today sits in neither of those camps. It is the complete clinical picture, 10 genuine, research-supported, physiological and psychological benefits of regular sexual self-care for men over 50, and 10 real risks that require understanding and management for this practice to remain healthy. Both sides of the coin, with a specific relevance to men in their seventh decade and beyond, clearly addressed throughout. Before we get into the content, please subscribe to this channel and turn on your notifications if you have not already. Every week, I publish honest, evidence-based content on men's sexual and overall health that is designed to give you the complete picture that your doctor rarely has time to provide. If today's video lifts a weight you have been carrying, please share it with a man in your life who needs it. And now, let us begin. The 10 benefits. Benefit 1. Maintenance of penile tissue health and prevention of fibrosis. For men over 50, regular penile blood flow is not merely a feature of sexual function. It is a maintenance requirement for the structural health of the penile tissue itself. The erectile tissue of the penis, primarily the corpus cavernosum, is a specialized spongy tissue that requires oxygenated blood flow to remain elastic, healthy, and functional. During an erection, the penile arteries dilate, and blood floods the corpus cavernosum, stretching the smooth muscle and connective tissue, and delivering oxygen to the cells throughout the tissue. This regular oxygenation is essential for preventing the process of fibrosis, which is the gradual replacement of elastic smooth muscle tissue with inelastic collagen fibers. Fibrosis of the penile tissue is a documented consequence of insufficient regular erections. Research in neurology has demonstrated that the spongy tissue of the penis undergoes progressive fibrotic change when it is not regularly engorged with blood, leading to reduced elasticity, reduced maximum engorgement, and reduced erectile rigidity over time. The clinical principle is the same one that governs all body tissue. Use it or lose it is not merely a motivational phrase. It is a description of what happens to smooth muscle tissue in the absence of regular loading. For men over 50, regular sexual self-stimulation, by reliably producing erections and the blood flow they deliver, functions as a form of physical therapy for the penile tissue. It maintains the structural health and functional capacity of the erectile tissue in ways that are directly relevant to the quality and reliability of erectile function with a partner. Benefit 2. Prostate health and cancer risk reduction. The evidence for this benefit is substantial, longitudinal, and drawn from one of the most rigorous cohort studies in epidemiology. A study published in the Journal of the American Medical Association, conducted by researchers at Harvard Medical School, following over 30,000 male health professionals for 18 years, found that men who ejaculated more frequently had a significantly lower risk of developing prostate cancer. Specifically, ejaculation frequency of approximately 21 times per month was associated with a 33% lower risk of prostate cancer compared to infrequent ejaculation. The biological mechanism I discussed in a previous video on this channel is worth reiterating here. The prostate gland continuously produces secretions that accumulate between ejaculations. When ejaculation occurs regularly, these secretions are expelled, the glandular ducts are flushed, and the opportunity for inflammatory compounds and potentially carcinogenic substances to concentrate in the prostatic tissue is reduced. When ejaculation is infrequent, stagnation of these secretions creates a microenvironment associated with increased cellular stress and inflammatory change. For men over 60 who are in the age group with the highest incidence of prostate cancer and who are also most likely to be experiencing symptoms of benign prostatic hyperplasia, the protective effect of regular ejaculation on prostatic tissue health is one of the most clinically meaningful benefits of this practice. It is not a guarantee against prostate cancer, and it does not replace PSA screening and clinical monitoring. But it is a genuine and evidence-supported protective factor within a comprehensive approach to prostate health. Benefit 3. Pelvic floor strengthening. The involuntary muscular contractions that occur during orgasm engage the pubococcygeus muscle and the broader pelvic floor musculature in a specific, rhythmic, high-intensity pattern. From a purely mechanical standpoint, these contractions constitute exercise for muscles that are critical to bladder control, bowel control, erectile function, and ejaculatory control. For men over 50, pelvic floor muscle strength is a direct determinant of several quality of life outcomes. Weakened pelvic floor muscles are associated with urinary incontinence, reduced erectile rigidity, reduced ejaculatory force, and reduced sexual sensation. The pelvic floor contractions of orgasm, occurring regularly, help to maintain the strength and neuromuscular coordination of these muscles in a way that deliberate pelvic floor exercises, Kegel exercises, also address, but that this practice provides automatically as a benefit of the broader experience. Men who are already performing deliberate pelvic floor strengthening will find that regular sexual activity complements and reinforces those efforts. Men who have not incorporated pelvic floor training are receiving some of its benefits through this practice, whether or not they are aware of it. Benefit 4. Cortisol reduction and cardiovascular protection. Orgasm produces a documented and measurable drop in circulating cortisol, the body's primary stress hormone. This drop is not trivial in its magnitude or its consequences. Cortisol is one of the most physiologically damaging hormones when chronically elevated, and chronic cortisol elevation in older men is associated with hypertension, accelerated atherosclerosis, insulin resistance, immune suppression, testosterone suppression, and cognitive decline. The post-orgasmic cortisol reduction is mediated partly by the surge in oxytocin that accompanies orgasm, as oxytocin directly antagonizes the cortisol response, and partly by the shift in autonomic nervous system balance from sympathetic dominance toward parasympathetic dominance that orgasm reliably produces. Both of these mechanisms are relevant to cardiovascular health, and the reduction in blood pressure that follows orgasm is not merely a momentary effect. Regular parasympathetic activation through regular orgasmic experience contributes to a lower baseline cardiovascular stress burden over time. For men over 50 who are managing hypertension, elevated cardiovascular risk, or the effects of chronic stress, this is not a minor or incidental benefit. It is a physiologically meaningful contribution to a health domain that is among the most critical for men in this age group. Benefit 5. Neurochemical mood support. Orgasm triggers one of the most significant neurochemical cascades available to the human body through natural means. Dopamine, the neurotransmitter of motivation, reward, and positive anticipation, surges in the period approaching and during orgasm. Oxytocin creates feelings of warmth, connection, and emotional well-being. Endorphins, the body's endogenous opioids, contribute to feelings of pleasure and the reduction of pain and anxiety. And serotonin, elevated in the post-orgasmic period, contributes to mood stability and a sense of calm satisfaction. For men over 50, who may be navigating the emotional challenges of this life stage, including retirement transitions, the loss of friends and partners, reduced social engagement, existential weight of facing later life, the regular availability of this natural neurochemical mood support is genuinely clinically significant. It is not a substitute for social connection or professional support where those are needed, but it is a real, consistent, cost-free source of neurochemical well-being that is available regardless of circumstances. Benefit 6. Improved body self-knowledge and early detection. Men who engage in regular sexual self-care develop a degree of familiarity with their own genital anatomy that men who do not are less likely to have. This familiarity is clinically valuable because it increases the likelihood of noticing changes that warrant medical attention. Testicular changes, including new lumps, areas of firmness, or changes in size or shape, are most likely to be detected early by men who are regularly familiar with their own anatomy. Penile changes, including the development of plaques or areas of increased firmness associated with Peyronie's disease, or any unusual skin changes, are similarly more likely to be detected by men who have regular attentive contact with their own bodies. Peyronie's disease, which is the development of fibrous plaques within the tunica albuginea of the penis that cause painful curvature during erection, is considerably more prevalent in men over 50 than is generally appreciated, with some studies estimating prevalence as high as 10% in this age group. Early detection and treatment significantly improves outcomes. Regular self-familiarity is one of the primary means by which early detection occurs. Benefit 7. Sleep quality improvement. The post-orgasmic neurochemical environment is directly and powerfully conducive to sleep onset and sleep quality. Prolactin, which surges significantly following orgasm in men, is strongly associated with feelings of deep relaxation and the transition towards sleep. Combined with the post-orgasmic elevation of oxytocin, the drop in cortisol, and the shift toward parasympathetic autonomic tone, the physiological state following orgasm is one in which sleep onset is genuinely facilitated. For men over 60 who face a significantly elevated prevalence of sleep difficulties, including insomnia, reduced deep sleep stages, and the sleep disturbances associated with conditions like sleep apnea and prostate-related nocturia, any natural, non-pharmacological mechanism that supports sleep quality is worth taking seriously. The regular availability of this sleep-promoting mechanism through sexual self-care is a genuine and underutilized tool for sleep health in this age group. Benefit 8. Pelvic circulation and lower urinary tract health. The vascular engorgement that accompanies sexual arousal and orgasm extends beyond the penile tissue itself to the broader pelvic region, including the perineal musculature, the bladder, and the surrounding pelvic vasculature. This increase in pelvic blood flow has benefits for tissue oxygenation and cellular health throughout the lower pelvis. For men over 50 who are experiencing lower urinary tract symptoms associated with benign prostatic hyperplasia, the improved pelvic circulation associated with regular sexual activity contributes to the health of the surrounding tissue environment in ways that complement other approaches to managing these symptoms. It does not treat BPH, but it contributes to pelvic tissue health in a manner that is genuinely beneficial within the broader picture of lower urinary tract management. Benefit 9. Ejaculatory control training. The solo practice environment is the optimal context for developing and maintaining ejaculatory control because it removes the additional variables of partner presence, performance anxiety, and interpersonal dynamics that make ejaculatory control more challenging in partnered sex. In this environment, a man can practice the stop-start technique or the squeeze technique, both well-evidenced behavioral interventions for premature ejaculation with complete control over the pace and conditions of the practice. For men over 60 who are experiencing reduced ejaculatory control as part of the broader changes in sexual function that accompany aging, or who are returning to partnered sexual activity after a period of absence, solo practice provides a graduated, low-pressure training environment for rebuilding the neural pathways and voluntary control mechanisms associated with ejaculatory management. Benefit 10. Maintenance of neurosexual circuits and libido preservation. Sexual arousal and response depend on neural circuits that, like all neural circuits, require regular activation to remain efficient and responsive. The principle of neuroplasticity applies directly here. Circuits that are regularly activated maintain their connectivity and efficiency, while circuits that are rarely activated lose synaptic density and responsiveness over time. For men over 60, the preservation of these neural circuits is directly relevant to libido, arousal responsiveness, and the capacity for sexual engagement with a partner. Regular sexual self-stimulation keeps the brain's arousal circuits active, maintains the responsiveness of the nervous system to sexual stimuli, and prevents the kind of progressive disengagement from sexuality that can occur when sexual activity of any kind ceases for extended periods. The practical consequence is that men who maintain regular sexual activity, including solo activity, are more likely to remain sexually responsive and capable of partnered intimacy when it is available, than men who allow all sexual activity to lapse entirely. The 10 risks. Risk 1. Substitution for human intimacy and social connection. The most important risk for men over 60 is not physical, it is relational. When sexual self-care gradually replaces rather than complements the pursuit of human connection and intimacy, the result is a progressive narrowing of the social and emotional life that is one of the most important determinants of health and longevity in older men. Loneliness and social isolation are documented independent risk factors for cardiovascular disease, cognitive decline, depression, and all-cause mortality in older adults. Sexual self-care can become a comfortable alternative to the more challenging work of maintaining and developing genuine human connection. And for men who are already socially isolated or emotionally withdrawn, the risk of this substitution is real, and worth consciously guarding is clear. Use this practice as a complement to your intimate and social life, never as a replacement for it. Risk 2. Skin vulnerability and the necessity of lubrication. After 60, the skin throughout the body undergoes documented changes: reduced collagen production, thinning of the dermis, reduced elasticity, and slower healing of any damage that occurs. The skin of the penis and perineum is subject to these same age-related changes, and the friction of sexual self-stimulation without adequate lubrication produces microscopic tears, inflammation, and the risk of bacterial colonization at sites of compromised skin integrity. This is not a minor consideration. For men over 50, the use of a water-based lubricant during any sexual self-stimulation is not optional. It is a basic requirement for maintaining the skin health of the area in a way that prevents the inflammation and discomfort that chronic friction damage can cause. Treat the skin of this area with the same consideration you give to any other area of skin that requires care and protection. Risk 3. Sensory desensitization from inexperienced stimulation. The nervous system habituates to stimulation patterns that are unchanging. When a man uses an identical technique, identical grip pressure, identical rhythm, and identical pace for every solo session over years and decades, the neural pathways associated with these specific stimulation patterns become progressively more specialized to them. The consequence is that stimulation that deviates from this established pattern, including the qualitatively different sensations of vaginal intercourse, produces less arousal and less reliable response. This phenomenon is related to the death grip desensitization I have discussed in other videos, and it is entirely preventable through the deliberate introduction of variety into solo practice, varying grip pressure, pace, position, and the areas of the penis given most attention across different sessions. The nervous system responds to novelty by remaining broadly responsive. Variety in solo practice is not merely a matter of personal pleasure. It is a form of neural health maintenance. Risk 4. Solo performance masking underlying vascular or hormonal dysfunction. A man who can reliably achieve erection during solo practice, but who consistently loses erection in partnered sexual situations, should not assume that the problem is purely psychological or related to the partner dynamic. While performance anxiety is a genuine and common contributor to this pattern, it can also mask underlying vascular or hormonal pathology that is manageable when properly identified. Conditions including early endothelial dysfunction, reduced testosterone, cardiovascular disease affecting pelvic blood flow, and diabetes can all produce a pattern in which the lower arousal threshold, lower cortisol conditions of solo practice allow adequate erectile function, while the additional demands of partnered sex exceed the compromised vascular reserve. If this pattern is consistent, it warrants clinical investigation rather than simple reassurance. Risk 5. Pudendal nerve compression from posture. The pudendal nerve compression from posture. The pudendal nerve, which I have discussed in detail in other videos on this channel, and motor nerve of the pelvic floor and external genitalia. It is vulnerable to compression when sustained pressure is applied to the perineum, and the posture of hunching over a hard seat with the weight concentrated on the perineum, maintained for extended periods during solo sexual activity, can produce precisely this compression. Pudendal nerve compression from chronic postural patterns is associated with perineal numbness, reduced genital sensation, and pelvic pain. For men over 50, whose connective tissue and nerve healing capacity are less resilient than in younger decades, this is a risk that warrants specific attention to posture during solo practice. Lying down with proper spinal support is the most protective position. Risk 6. Psychological dependency and emotional avoidance. For men over 50 who are dealing with grief, the loss of a partner, retirement identity challenges, financial stress, or social isolation, the dopamine reward mechanism of sexual self-stimulation can become a primary coping tool for emotional discomfort. When this happens, the practice is no longer serving health and well-being. It is serving avoidance. The clinical distinction is between using this practice as one component of a broadly healthy and engaged life versus using it as the primary mechanism for managing emotional states that would be better addressed through genuine social engagement, professional support, or purposeful activity. If you notice that solo sexual activity is increasing during periods of emotional difficulty rather than during periods of general well-being, that pattern is worth examining honestly. Risk 7. Culturally conditioned shame and its physiological consequences. Many men over 60 grew up in cultural, religious, or family environments that communicated strong negative messages about masturbation. Those messages absorbed in childhood and adolescence do not simply evaporate in adulthood. They persist as a layer of guilt and shame that for some men actively undermines the health benefits of the practice through the physiological mechanism of shame-induced cortisol elevation. Shame activates the stress response. Chronically elevated cortisol from persistent shame around irregular behavior suppresses testosterone, impairs immune function, and produces precisely the harmful hormonal environment that this practice is otherwise capable of reducing. The clinical intervention for this is not to simply tell men to stop feeling ashamed, which is not how the psychology of shame works. It is to replace the shaming messages with accurate clinical information, which is exactly what today's video is providing. Risk 8. Prostatic congestion from excessive frequency. Just as infrequent ejaculation allows prostatic secretions to stagnate and creates inflammatory conditions, excessive ejaculation frequency can create a different problem. Pelvic congestion, in which the repeated engorgement and drainage cycle exceeds the tissue's recovery capacity, leading to a persistent sense of heaviness, aching, and sometimes urinary discomfort in the perineal and prostatic region. For most men over 60, this risk is significantly less common than the risk of insufficient frequency. But for men who are engaging in multiple sessions daily for extended periods, prostatic congestion is a genuine possibility that produces real discomfort. Moderate, regular frequency, rather than either extreme, represents the optimal approach for prostate health. Risk 9. Physiological recovery and the need for adequate intervals. Following ejaculation, the body undergoes genuine physiological recovery processes. Hormonal rebalancing occurs, neurochemical restoration takes place. The tissues involved in arousal and ejaculation require recovery time before the next cycle. The length of time required for adequate recovery increases with age, and men over 60 who ejaculate daily may find that the cumulative recovery deficit expresses itself as fatigue, reduced mental sharpness, or a general sense of depletion. When these symptoms are present, they are reliable biological signals that the interval between sessions needs to be increased. A 48 to 72-hour interval is a reasonable starting point for men experiencing these symptoms, with the optimal frequency determined by how well each individual feels in the period following ejaculation rather than by any universal prescription. Risk 10. Pornography-driven dopamine dysregulation. When sexual self-stimulation is consistently paired with high-intensity, high-novelty pornographic content, the dopamine system calibrates to that level of stimulation. Over time, the elevated dopamine threshold created by repeated pornography use makes the more modest arousal stimuli of real intimate interactions, a partner's presence, touch, and emotional connection insufficient to produce the same level of dopaminergic response. The result is reduced responsiveness to genuine intimacy and a progressive narrowing of the arousal system toward artificial stimulation. For men over 50 who are in or seeking intimate relationships, this risk carries real relational consequences. The brain that has been conditioned to require highly escalated visual stimulation for adequate arousal is the brain that will find real partnered intimacy comparatively unstimulating. The intervention is to practice sexual self-stimulation, increasingly in the absence of external visual content, relying instead on imagination and present-moment physical sensation. This recalibrates the dopamine system toward a baseline that allows real-world intimacy to be genuinely arousing again. I am Magda Kay. I will see you in the next video.